So hello friends, welcome to my new video. So today in this video I will discuss about viral keratitis. Okay, so let's start. So today we will discuss about herpes simplex keratitis, and this herpes simplex keratitis is due to herpes simplex virus that we call this virus in short form HSV. Okay, so HSV infection is very common, and we mostly see this type of infection to the patients who are under steroid medication, or people having immunosuppressive disorders, or those people who are having some ocular surface disease. Okay, so herpes simplex virus is a double-stranded DNA virus with a lipid envelope. So with alcohol swab, clean the tonometer tip before measuring IOP to prevent any infection. Why? Because suppose in your clinic a patient having herpes keratitis comes to your clinic and you did the full workup, starting from vision taking to slit lamp examination, and along with some additional tests that I will discuss in the later slides. So after performing the workup and after measuring the IOP with the help of Goldman applanation tonometer, you forget to clean the applanation tonometer tip, and you measure the IOP of another patient with that unclean tonometer. So there will be a chance of a transfer of the infection from a affected person to a healthy person. So never forget to clean the tonometer tip. Okay, so HSV virus or herpes simplex virus is two types: herpes simplex or HSV1 or HSV and HSV2. Okay, and here I wrote type 1, that is HSV1, and type 2 is HSV2. So type 1 HSV causes infection above the waist, which include the face, eyes, lips, neck, this area, and HSV2 causes infection below the waist, that is the genital area. Okay, so if we tell that how it transmit, so it actually spread by droplet transmission. And okay, so and most primary infection will include mild fever along with respiratory disorder, and eyelid also may get affected and lead to blepharoconjunctivitis. So due to abnormal eyelashes, these eyelashes can be misdirected and it can rub the cornea, so it can also lead to some corneal scarring. Okay, if the eyelid is involved, and cornea also gets stretched and it leads to infection. Okay, so after primary infection, so there is two type of infections are there, okay, of herpes simplex virus. One is primary infection, another is recurrent infection. So primary infection means or it's seen in the patient who are more than 6 months of age. Primary infection means the patient is infected by herpes simplex virus freshly. That is the primary infection. And recurrent infection means the HSV infection or keratitis is treated, but after some time it again appear. So this is called as recurrent infection. Okay. So after primary infection get treated, recurrent HSV infection may also seen. So what are the symptoms of herpes simplex virus infection? Okay, so symptoms are redness, lacrimation, photophobia, and blurring of vision. So the patient will complain like redness of eye, lacrimation, photophobia, blurring of vision. So take the history and note the each and every history properly, and don't forget to ask history of fever or history of medicines, because HSV infection is mostly due to steroid medication intake or due to some ocular surface disease. So don't forget to ask like do you have or do you had any previous ocular injury or any ocular disease that is treated elsewhere or something like that, or what are the medication that you are using. This type of question you should ask to the patient, so this will help you to take the proper history of this type of infectious patients. Okay, so if we tell about the signs of HSV infection, so do the slit lamp examination after staining with fluorescein dye and see what is there. In viral keratitis, you will see a linear branching like structure. Those are called dendritic pattern. Okay, so I will show in the later slide that how this dendritic pattern will look. Okay, so when some dendritic pattern coalesce together, it forms geographical keratitis, which look like a shape of amoeba. Okay, and another thing is that follicular conjunctivitis. So follicular conjunctivitis are also important sign you will see in the conjunctival sac. Here the granular or structures are there in the conjunctival sac, and also the patient having HSV keratitis have reduced corneal sensation. So this is why it is very important to measure the corneal sensation with a cotton swab. Okay, just touch the swab to the corneal different superior, inferior, nasal, temporal area, so that you can understand at what area sensitivity is more. Okay, so this type of keratitis are sometimes self-resolving, so you will also observe epithelial haziness. Okay, so this is what I was telling. These are the dendritic pattern that is visible. Okay, so here it is very clearly seen that these are the linear structures, these are the dendritic pattern you can see. So this only seen in HSV keratitis. Okay, and in other type of keratitis like acanthomba keratitis or fungal keratitis, so you will also find dendritic like shape, but those are not actual dendritic pattern, those are called pseudodendrites. But HSV dendritic pattern will look like this. Just remember, these are very prominent and linear structure, but in case of pseudodendrite there is presence of infiltrates in the side of the dendrite. So from this you can just differentiate what is pseudodendrite and what is actual dendritic structure. Okay, and another thing is that this is the geographical keratitis that I was telling. So this is due to collision of several dendritic structures together. Okay, another thing is that this is the follicular conjunctivitis, and here you can see this is a granular structure like formation in the conjunctival sac, you can see, and this is the epithelial haziness. Okay, so investigation actually in viral keratitis, and there is no need to send the patient for investigation purpose, because from this type of clinical presentation we can easily get to know that yes, this is a case of fungal, oh sorry, viral keratitis. But in there is some procedure also available like PCR or PCV also can be done to find out what is the type of organism. Okay, so if we move to the treatment, then the most effective drug of choice is acyclovir 3% eye ointment for 5 times in a day. Oral acyclovir 200 mg is given to immunodeficient patient and patient who with other ocular surface disease. And due to this herpes simplex infection, if the patient is having any skin lesion, then acyclovir 5% ointment also given to the patient. And steroid medication is not used unless there is presence of disciform keratitis. Okay, so that's all friends, thanks for watching. Please don't forget to like my video and subscribe to my channel. I hope this video helps you to understand about the viral keratitis more. Okay, so thank you so much.